Most of us know someone who is hesitant to be first in line for the COVID vaccine. In fact, last week we heard the head of Oxner say some of the medical staff were hesitant as well. The question is why?
Right. It seems to come down to trust. Some are wondering if they can trust the vaccine, especially since it was expedited into production. Medical reporter Meg Ferris has the Vax facts that you need to know.
Tulane microbiology and immunology expert Dr. Morici explained why COVID vaccines were not rushed and no corners cut. First, the way it tells your immune system to make fighter cells has been studied for 30 years.
It took many years of scientists and engineers making small advances, incremental advances over the years to get the technology to a point where it works terrific.
These are not traditional vaccines. They're called plug and play, perfectly designed for a pandemic because they can quickly be changed depending on the virus endangering the community.
We already knew that these platforms were effective and safe. They've been in tens of thousands, if not hundreds of thousands of people for other diseases.
Next, the clinical trials. 1, for scientists worldwide, it was all hands on deck. 2, it was easy to get thousands of volunteers because people wanted to help. And 3, the phases could overlap because pharmaceutical companies did not have the huge financial investment and risk.
The federal government and other agencies committed more than $26 billion towards the development of these vaccines. And that's unprecedented.
Data on how well the vaccines work came out fast because so many people were infected in the community around those vaccine volunteers.
And so we were able to get the information lightning fast, as opposed to what would typically take us years.
To people who don't want to be first to get vaccinated, well, you're not.
Millions, tens of millions of doses of these vaccines have been administered to people. They are extremely safe. They're some of the safest vaccines that have ever been developed.
For those worried about long-term side effects, Dr. Morici says throughout vaccine history, complications have shown up within 2 months.
We're well beyond the 2-month period with these vaccines. Millions and millions of folks, many months have passed. There's no reason to wait.
Meg Ferris, Eyewitness News.
The doctor also says there are no toxic preservatives in these vaccines. All the ingredients are natural ones that are found in the body.